Picture this, I'm a bag of dicks, put me to your...
Hey, brothers, sisters. Let me see. I don't have the headphones on because I can't generally even hear myself through them. Can I hear myself? No, it's just basically silent. I'm still trying to figure out this podcast thing, and welcome back to Lotek Talks. Let ourselves translate expert knowledge. I'm Brad Burns. Today is Forgive My Foul Mouth Friday. I'm gonna try my best not to break the huck meter, but it is the day of basically saying whatever. No script, nothing. So I'm going to start off today bitching about ratios, nursing ratios, which only one state in the entire country has set an actual law about the ratios. Every other state, you got to figure it out on your own, which means each hospital decides what they want to be to have as a ratio. Which anyone who doesn't know, a ratio is how many patients one nurse can have. A lot of times, the expectation is like 6. We went 6 to 8 patients deep each night on my old med-surg floor, and then I went to ICU, which generally ICU is like 2 patients, but they had us take 3 a lot, very often. And some of the excuses they'd use for us to be able to handle it is you have an orientee, someone you're training, who you can throw around and have an extra set of hands so you can handle it. You can handle it. But, and you know, it's not the point. It's not the point. Yeah, you can handle it, but the point is they come to the ICU to try to get better. That's where we have you come to be fixed. It's a critical state of health, and if we're doing what we can handle, you know, taking as much as we can handle, then yeah, why not have 4, 5? Why not just keep spinning plates until one breaks? Who cares? Who cares about that? What does that really matter? And it's frustrating because you want to do the right thing, you want to help people, but you start to realize that your time is thin. You got 168 hours in a week, which 36 of those are spent devoted to the hospital. It's really more like 37 and a half. You include your 30-minute lunch, which everyone gets their 30-minute lunch, and 2 15-minute breaks, which I don't know if anyone's paid attention in the last year or so, but it became a little bit of an issue because that is an OSHA requirement for standard 8-hour shifts to get 30-minute break for lunch and then 2 15 minutes, which depending on the hospital, they're not going to emphasize through the charge and the leadership that you get it. You're just got to figure out when you can get it yourself, kind of fight for it. And if you do make it a big deal and are very adamant about getting your 30 minutes and your 2 15s, you're going to be targeted and called out a little bit because you seem like a tryhard or not a tryhard, but the opposite, where you just don't give a fuck about your patients. Why are you taking a break? They're critical. You need to stay on the floor. And yeah, that's a good point to that, but we're human. We need a break. You need a break. You're not focusing well. To relay it to how residents, doctors go through their training, they do, from what I understand, some 30-hour rotations with an hour nap. 30 hours working.
Sorry, I don't understand.
Wasn't talking to you. That was weird. These robots, they'd like to replace us with robots. They'd like us to be easily replaced by robots. But it's not going to work because they're not very smart. They're not very smart. They don't know how to talk very well. They don't know what humans are. But 30-hour rotations with an hour break it's insane. 24 hours awake and you're the equivalent of a 0.10 alcohol blood level, like blood alcohol level rather. And you're supposed to be determining decisions that keep people alive, especially as providers, and you're basically drunk. Which, to cope with these, a lot of people do drugs and alcohol, unfortunately. There's that podcast, the Dr. Death, This dude was drinking handles of vodka and snorting coke and then getting to surgery, and he was performing very bad surgeries. He was a bad surgeon. Very bad. Very bad. But the dude who, I need to look his name up. I should have had his name ready. But this fucking guy who they based the residency off of in the, oh God, I don't know, like 50s? I feel like it was even further back. It had to be further back. He was doing cocaine. That's how he was staying awake for 30 hours. And you know how they got him off of cocaine in his later days, in his 70s? Yeah, it's like 60s or 70 years old. They got him off of cocaine by getting him on a heroin. Great replacement. It's good medicine. You have a doctor's prescription. Why not take it? Forgive my foul mouth, but it's my fucking day off, and of course it's raining outside, so I'm wearing my pretty flower hat and try to boost my spirits, enjoy myself. Because we got to take our enjoyment. We got to take our 15s. We got to take our time. We only have 168 hours in a week, and we're basically cogs in a wheel in the hospital. There's this newer nurse that I usually try to share as much as I can with new nurses and just talk to them about what the expectation of the hospital industry is, because there's a lot of cognitive dissonance when you get into the hospital out of nursing school, because we mostly want to help people. It's a great thing. The starfish story is the reason I'm in the hospital, which, a quick paraphrasing of it, there's an old man walking on the beach after a huge storm. All these starfish have washed up and the sun's starting to come up. They're getting crusty. They're going to die. And he turns a corner, looks under a pier. He sees this young man who's just frantically running up and down the coast, and he's grabbing each starfish and tossing them in the ocean as fast as he can. The old man finally catches up to him and says, "What are you doing? You're never going to make a difference. There's literally thousands of these starfish." The young man reaches down, picks one up, tosses it in the ocean, and says, "I made a difference to that one." And that's why I'm still a nurse and not in like some Wall Street. I'd like to get back in entertainment, but basically it's to expose the public to this kind of industry and explain 6 to 8 hours waiting in the emergency room to get an inpatient medical surgical room in the hospital is a good wait time.